The most recent guidelines for the diagnosis, treatment, and management of the spread of diphtheria are listed in the Operational Protocol for Clinical Management of Diphtheria, published in 2017 by the World Health Organization. This guideline includes standards for infection prevention and control to include healthcare providers, initiates standard, droplet, and contact precautions as soon as possible, as soon as diphtheria is suspected. Isolating the individual immediately upon suspicion is crucial. The disease is usually not contagious after 48 hours of appropriate treatment, and at this time the patient can be discharged home if they are deemed medically stable. However, they should restrict contact with others until antibiotic regimen is complete. This includes staying out of school, work, and away from populated areas such as grocery stores, parks, etc. Throat specimens are only encouraged if the diagnosis is unclear or resistance of antibiotics is suspected, and treatment should not be delayed while test results are pending. Antibiotic therapy should be administered as soon as possible. IV and intramuscular routes for critically ill patients and those unable to swallow are indicated. For all other patients, oral therapy is appropriate. Penicillin, erythromycin, and azithromycin are the appropriate antibiotics to prescribe. Providers should see the World Health Organization recommendations to dose these medications. While hospitalized, patients' condition, especially respiratory and cardiac function, should be monitored at minimum every 2 to 4 hours, and more frequently for children and those who are critically ill. Once treatment of the patient is initiated, determining close contacts to the patient is critical to preventing spread. These contacts should be treated with antibiotics and vaccinated as is individually appropriate.